Quite often, patients undergoing surgery for prostate cancer are asked in regards to whether they will require a catheter in their penis after the procedure. Quite often, most protocols include inserting a Foley catheter after the procedure, and this will remain for a variety of time, usually is approximately 1 week. There are certain centers that are able and have published a prior series of not placing a urinary catheter in the penis for a prolonged period of time. However, placing a catheter, a tube, out of the abdomen, which is inserted at the time of surgery. This is called a suprapubic tube. Not all centers are utilizing this, and the data is conflicting in regards for the clinical efficacy of the suprapubic tube versus a Foley catheter. The purpose of the Foley catheter is not merely to torture our patients, but to allow the urethra and the bladder anastomosis to in fact heal. After a certain period of time, at the discretion of the surgeon, they may also perform a cystogram to ensure that there is no urinary extravasation or leakage prior to the catheter removal.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed. But right now, a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.